بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is a new case discussion as we see here in this spot view of the IVU at the 5 minutes, and we see the kidneys of the long axis of the kidneys are parallel to the spine, and the lower ball kidneys are more medially than the usual. And this is a classic case of horseshoe kidney. The horseshoe kidney are the most common fusion defect of the kidneys, and it is present in about 0.25% of population, and also identified the functioning lower ball is presenting in about 70 to 80% of cases. And horseshoe kidney, as we see here, can be identified on the IVU, also can be identified in another in other imaging modalities like CT, MRI, ultrasound, and in nuclear medicine. And CT and MRI are the best demonstrating anatomy and demonstrating also the accessory vasculature and surrounding structures. Can you remember the relationship between the lower ball kidney and inferior mesenteric artery? What is the importance of this anomaly? What is the importance of this association? And also the horseshoe kidney has increased incidence to hydronephrosis secondary to pelvic junction obstruction, increased incidence of renal calculi, and it is more susceptible to trauma and infection and biliuretritis cystica. Horseshoe kidney also increase incidence for the tumor like Wilms tumor, transitional cell carcinoma, and renal carcinoid. Also, horseshoe kidneys has increased incidence to renovascular disease. Sometimes it is possible uh, to identify the horseshoe kidney in the brain film. Is there any role of nuclear medicine? Yes, there is role of nuclear medicine in identifying the horseshoe kidney, also identifying the functioning isthmus. As we said, it is more in the lower ball in about 80%, and also identifying if there is reflux or not. Also identify the uh, pelvic junction obstruction. As we see here, the calyces and the malrotation of the calyces and some dilatation of the calyces. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك.